My name is Iliani. My topic is of vaginally contact Dapivirine for HIV-2 prevention women. Definition. Is the flirty osteoplasty, a daily we set of approximately 5.5 cm diameter and thick of about 4 mm contain the several and progress that the chairs only relax and long of the 21 days in which insert in the vagina. The vagina will relax to the carrier Dapivirine, which can help stop the virus for infected cells. According to an article published resulting in the New Ireland Journal of Medicine in a conventional vaginal way in an antiviral drug, it can prevent to spread AIDS, as already said in the course video.
Research is showing that a monthly insertable ring made just for women called Dapivirine reduced risk of acquiring HIV by 56% among women who use it consistently and by more than 76% among those who use it the most during 2 trials in Africa. This new data is being announced just ahead of the AIDS 2016 International Conference in hopes for 2 new studies with the device to start in the next few months.
Application in nursing. Hypertension in some cases, several headaches, vomit, inaptitude, imports in the acid body weight. Video.
A recent study says a vaginal ring infused with an antiviral drug appears to offer some protection against HIV infection. Scientists reported in the New England Journal of Medicine that women who used the ring had a 27% lower risk of HIV infection than women who received a placebo. A second separate study had similar results, finding a 31% reduction. Both studies were released during the annual conference on retroviruses and opportunistic infections in Boston. The trials involved women in sub-Saharan Africa, a region hard hit by the epidemic.
Pros and cons. Advantages. The risk and contracting the human immunopathic virus HIV in women was reduced 56%. The flexibility is just for women to research and provide with Dapivirine is to help include location to the site of potential infection during vaginal sex. The vaginal ring is not biodegradable. Disadvantage. The ring can slip or accidentally leave your vaginal during intercourse, bowel movement, or the tanky tampon. Some women have difficulty with their genital manipulation. Video.
This World AIDS Day, women have reason to be optimistic that a new era may be at hand, one in which they would have access to a discreet and long-acting form of protection against HIV. We saw an important step forward for women's health early this year when results were reported from 2 major studies, the RING study and ASPIRE, which evaluated whether a vaginal ring that slowly releases an ARV drug called Dapivirine could prevent HIV. The ring, which was developed by the non-profit International Partnership for Microbicides, would be replaced each month by women themselves.
Both the ring study as well as the ASPIRE study showed that the ring is safe, and both have proven efficacy. And that's what we need for a licensure program.
In both the Ring study and Aspire, the risk of HIV infection was about 1/3 lower among women who used the Dapivirine ring. In Aspire, women who used the ring most consistently saw their HIV risk cut by more than half. After years of research,
Issue application effort. HIV infect 36 million people worldwide according to the United States accounting for HIV risk. UNAIDS 2 million the people become infected every year and more than 1 million people die or AIDS. In the United States, more than 1.2 million people have HIV, about 60.00 people become infected every year. Airplanes and than women, the separation is sometimes between the condom protectors for HIV. Video.
More than half of those living with HIV around the world are taking treatment. This has been revealed in a new report by the United Nations, which also shows that AIDS-related deaths have halved since 2005, from 2 million to 1 million in 2016. The Joint United Nations Programme on HIV/AIDS, known as UNAIDS, says there were particularly encouraging signs from Africa. Eastern and Southern Africa are leading the way, reducing new HIV infections by nearly 30% since 2010. Malawi, Mozambique, Uganda and Zimbabwe have gone further, cutting new infections by 40% or more since 2010. UNAIDS Director Michelle Sibude, however, says while great progress has been made, there's still much more work to be done.
I will insist that a lot more still needs to be done. It is important that we have really shown that we...
Conclusion. Although the use and many CT students opened the door to the novel prevention strategy in the women rate for HIV infection. Further, students are never forced to start therapy of plastic vaginal ring in the department can be available in my video.
To discuss and cross-collaborate on all things antimicrobial. I'm Michael Schmidt from ASM's This Week in Microbiology, and it's my honor to discuss some of the science being presented here at ICC-ICAC with the authors who are presenting papers, posters, platform talks at this week's meeting here in San Diego. We encourage your questions from the audience and through Twitter and our chat room at ASM Live. And please join me in welcoming our next guest, Dr. Miriam Mimi, who is from the University of Jean Monnet in Saint-Étienne, France. So welcome.
Welcome. Thank you.
So you have, I'm going to take my cheaters on and actually highlight what you're actually doing. You've developed a silicone vaginal ring that will deliver antiviral drugs that will hopefully protect women against the acquisition of HIV. So why don't you give us a little bit of the background of this project and then take us next through the methods. So welcome.
Thank you. My name is Miriam Mimi. I'm a Tunisian scientist and I am involved in PhD study in the University of Saint-Étienne. in France. So I performed my study at the University of Monastir in Tunisia after getting my baccalaureate for 6 years as a biotechnologist. And after I had the opportunity to be selected in the University of Saint-Étienne to do my PhD in a program, international program, Al-Idrisi.